have you.
Thank you, Meryl. It's wonderful to see everyone. Thank you. I'm going to share my screen here. Everyone see that okay? Yay. Awesome. My name is Claire, and we'll kind of get into a little bit more about our work. This presentation covers topics of substance use and kind of harm reduction in our community here in Juneau and Southeast. I am joining you today from Tlingitani, the ancestral and unceded lands of the Akwán and Takuquan people. And I mention this wanting to acknowledge not only in gratitude to the indigenous communities who've held relationship with this land for generation, but also acknowledging this as a point of reflection and to invite all of us to the work of dismantling oppressive practices that have impacted our indigenous people here. So I wanted to start us off with some agenda items just to give you a sense of what we'll be covering today on the topic of opioids, substance use, and then harm reduction. So I wanted to talk a little bit more about our relationship with ourselves and community and how that relates with our work of addressing substance use. What it is to be human. I thought about being a little silly and calling this presentation Sex, Drugs, and Rock and Roll. A professor also told me it's good to start your presentation with a little humor, but it really is the nature of being human and sometimes talking about difficult things, but part of kind of our complex as humans. And then thoughtfully reviewing some Alaska data that looks at opioids, what do those numbers look like in terms of data? And then our present and future efforts with addressing substance use. Where are we at and where do we want to go in our future? Behind this slide is Rachel Carson, and she's an example of a human that faced significant challenges taking action on something like opioids that were known, were kind of presented as these great options and opportunities for folks that might resolve and fix things. And in 1962, Rachel Carson published a book called Silent Spring, where she, in her work, was trying to address the sinister impact of pesticides and chemicals that were thought to be wonderful and helpful aids in agriculture. So she's a great hero of mine and a big champion in a similar way, like different field of study, but where she really was challenged to uncover the truths and perspectives of something that was really devastating nature, killing thousands of animals and birds. And like this, we've seen kind of the devastating effects that opioids have had on our individual loved ones, families, and community. So we love Rachel Carson. I also wanted to share some wisdom from a human that I deeply respect and admire, the late Dr. Walter Soboleff, who said, I'm paraphrasing here, but he shared this wisdom with us that when we know who we are, we don't hurt ourselves. And so in the beginning of this presentation today, I kind of wanted to talk a little bit about how do we know ourselves? How do we develop these connections to strengthen our self-awareness as a form of resiliency and then a protective factor to help us as we move forward in our work, in our families, in our communities. So, okay. Little warm-up activity, and I am not sure that we'll have a ton of time to do this, but if anything, I wanted to share a link that I'll put in the chat. I've been using this warm-up activity in a couple different settings, and most recently running this with a group at Lemon Creek Correctional Facility. And I love this exercise because it reveals pieces of ourselves and our past. And it's an I am from poem. So if you give me just a second, I will put this in the chat. And I will put this into the chat for folks to do on your own time. But this is a really neat exercise that involves kind of filling in the blanks, where a poem can say things like, I am from, and then you'll insert kind of a description of your childhood home, toys that you played with as a child, values that you grew up with. And if I can't drop this in the chat just here, because I've got a couple different things on my screen, I'll drop it at the end. And I wanted to just encourage folks to take a second in your day. It's a really fun exercise, and it can be fun for you to do in your work environments or just with colleagues as well. I love this. We do this also in Girls on the Run too. So, and Let Me Run. So knowing who we are relates to this emotional intelligence and the knowledge that we have about ourselves and this interconnection between family, friends, community. And it also creates intention for the practices that we have to help. And as we get into kind of looking at data about opioids and this really big picture of concern and crisis, it all relates to this interconnection in this web, but with you at the center. Another thing that we see and do sometimes is a family genogram. And for some folks, you know, you may have done this for people on this call, but this is a visual representation of kind of a family tree, but a little bit more than a family tree. It can be used to access dynamics and patterns that may exist within families, more about your history, and maybe presence that lies in your family with addiction. So this can help identify patterns of addiction and abuse within families, and it can reveal a lot. I like to kind of think back on our history and notice like where we have come from. And for me, this involves kind of exploring unresolved grief. Diving into my family history has helped me understand my family's past, understanding addiction in my own family, and identifying current relationships which may act as a trigger or a support. So on the left is my grandfather, Frank, and my grandmother, Willie, that grew up in Nazi-occupied Netherlands. And just understanding kind of their own challenges and some of the significant traumas that they faced. And then on the right is little me and my own family and my sister who is on this call. Thank you for joining, Keisha.
Glad to be here.
As a nurse, I sometimes encounter this boundary thing where people will walk right up to you and they might tell you the darndest things. Hey, can you look at my toenail? Or my grandma's in the hospital. I have all of these things going on. And you don't have to be a nurse. Maybe you've experienced this too. But in my experience, people have a tendency to tell you a couple things. They might tell you things that are causing you distress or discomfort. They might tell you things that are causing them pain or suffering. And they might tell you things that are bringing joy or hope. And so what I've been finding in my own practice is that the best thing I can do in my role is to listen thoughtfully, but not react, and to respond thoughtfully when I'm ready. So as we talk about opioids and substance use, our work is about building relationships. And in a world that I can sometimes find pretty overwhelming, I think it's been increasingly important for me to spread positivity, kindness, and hope. I get tired. I get cranky, exacerbated, and overwhelmed. And the best thing I can do when I'm trying to address these really big, complex social issues is to tap into those self-care needs that nourish me, and then kind of coming back to this long preamble that I'm giving for this presentation, which is about how do we take care of ourselves so we can be there for others. I ran across this recently and I really liked it, that true self-care is not salt baths and chocolate cake. It's making the choice to build a life you don't need to regularly escape from. And that, I think, for me resonates in just building intention of the practices, less indulgent about like, oh man, I'm gonna go get, a $5 kombucha and all those things, but how can I create ground and center in my own life practices that help me? How do we continue to do this in meaningful ways that are sustainable, and keep our inspirations alive? So the preamble to all of this is, a couple slides rooted in self-care and cultivating a deeper understanding of ourselves and boundaries so that we can discern ways to help heal without being reactionary and instead being responsive. I'm also really conscious of the language that has been used to describe efforts when addressing opioids and substance use in communities. And I've really been noticing how much the language matters in our descriptions and outreach. So where we commonly like open the newspaper or we pull up the newspaper online, let's be real, more presently, but we see these words like tag words. We're battling the plague of opioids, that we're targeting, that we're staging these targeting interventions, pretty harsh language. And it's pretty dramatic. The language that we use creates a feeling. And so an example might be fear. Like when we hear that and we're standing in a dark alley, that's the external sensation. And then our heart starts to pound. That's the internal sensation, but it's this connection of that word. So I've been noticing a lot on how, in language, we might say, I'm fighting for this community initiative. Whew. Like fighting battles is so hard. And we just tied into how important the sustainment of our efforts is. So thinking just about our language around like our cause and our efforts, it's kind of interesting. Okay, so what the heck is an epidemic? With the word epidemic, it's not a word that we saw so often before 2019. We heard a little bit, we saw opioid epidemic, and then we saw the word pandemic with the inception of COVID, where all of a sudden that just was everywhere and kind of in common language. And we understood the extent of pandemic because it was impacting so many. We watched communities across the world responding to kind of the needs. So a pandemic is a sudden increase in cases across several countries and continents of the world. It's a word that hopefully we'll never hear again in our lifetimes. And it's reserved for pretty dire situations, which we experienced with COVID. Epidemic is also a really rare word in epidemiology in the study of public health. It's reserved for pretty staggering numbers of an increase in cases spreading through a large population. And that's warranted, unfortunately, by the loss of lives from opioids and substance, both illicit and prescribed. There's also this word endemic, in that this word endemic, constantly present in a population or region with relatively low spread. So a couple of years ago, I was talking with a woman in New Mexico, and I was using the word epidemic to kind of dramatize or bolden the efforts. I was like, oh my gosh, it's like this epidemic and we really have to do things. And she listened, and then she reminded me that substance use is endemic as well. And I paused and I thought about it. So if the thought is to eradicate drugs off the face of the earth, we have to be quite honest and recognize that this really doesn't work. And we can look at prohibition to understand how this doesn't work and that we can't fight our way out of drugs. So kind of no more war on drugs. We know that this doesn't work. And if we look at the evolution and timeline, like we're talking about opioids and substances largely today, but we've seen like waves of heroin before in the 90s. We've seen crack in the 80s. We've seen different like substances visit us at different chapters in American life and Alaskan life. And so I think it's just important to pause and remember that I can't eradicate, as much as I would love to just take all substances off the face of the earth. That's not possible, and it's not realistic with our work. And so helps us with that like fighting language too. This is like, it's a part of our culture. It's a part of humankind. And we'll dive a little bit more into harm reduction strategies and why those are important too. Okay, so the epidemic, we're in an epidemic, and we got here with a moment of pause and reflection for the lives lost. When the history of America's long, devastating opioid crisis, has been going on for several years now, but in 2022, we might remember 2022. And I was just telling Meryl, it's kind of funny, like now we're in 2024, and I'm a little like, it's always a little hard to like crest the other side of like, okay, 2023 is closed out, but it also takes us a little bit of a while to gather our data and analyze that. But in 2022, we might remember just last year as both a pretty low point and also a really big turning point. And I wanted to share with you guys some really exciting things that happened in 2022 last year that gave us a lot of hope and momentum forward in kind of our efforts with this. We lost a lot of people in 2022. We lost over 100,000 people in a single 12-month period, which is a horrible new record. So we have some really promising advancements and ideas, and all of you on this call, I think, are participants and helps in that, and we have a lot to be optimistic about. Okay, a little bit of data here. And this sometimes is, every time actually it's hard for me to look at, but when we look at this information, again, this is a little behind from where we are today, but still really important. These are drug overdose deaths in Alaska, and showing that they have been on an increase. So all drugs, opioids, fentanyl. And then just to acknowledge that fentanyl is kind of this new chapter in our last 2 years, has been a really big concern. And that has been a big drug that's been entering our state and causing really devastating impact on human lives and our communities and our families and people and loved ones. Here in Juneau and the city and borough, this is kind of a breakdown. So we look at overdose death and the trends of that. If we look at fentanyl overdose, and that we recognize, I think it's important to, I have never met anyone that's really in a mutually monogamous relationship with one substance. So while we're focusing on opioids today, I think that substance use, people maybe use different substances throughout. They might drink, they might use a little bit of benzo, they might use meth sometimes. And that is important to acknowledge, because I think if we're concentrating our efforts just to say opioids, we're not being realistic and honest with the fact that we're talking about substance use and how to help people meet people where they're at. Opioid-related emergency departments. So on the bottom graph, this orange line is here in Juneau. And then in Alaska in general, these all relate to emergency department visits. So before I worked at public health, I worked in our emergency department, really focusing on high utilizers, or folks that were visiting the ER that had unmet social needs. And that was a really wonderful job to dive in deeper of like, how can we help make folks comfortable, safe, happy, healthy, that might be visiting the ER quite a bit, and really get to the root cause of like, what is their need? Because no one wants to visit the ER. No way. Okay, sometimes I'm looking at these numbers, or I was the other week when I was learning about population health mapping tools, and I just had to sit there and wiggle my toes. And because this is NAMI, and we love like the skills and tools that NAMI helps give us, just remembering like to employ our skills of like wiggle your toes, do your finger taps when you're kind of looking at big stuff, and that's our grounding energy. And that's a lot of information that we just looked at. We were just looking at human lives that are represented in graphics and illustrations. It's an important part of this conversation, but they're human lives, and these are our friends and loved ones. So to keep grounded. Let's look at some other examples of accomplishments that have helped us in public health and our world issues. So when we think back on epidemic, and we're thinking about major pharma companies, economic factors. We've heard about kind of Purdue as the pharmaceutical with Oxycontin, and that's a whole different presentation for a different time. But we're talking about the social determinants of health that kind of make up this really complex issue and where we are currently. And I think about the energies that drive the responses that maybe developed those pills, that pushed Oxycontin out there, where we had doctors that, prescribers thought this is the next best thing. There were clocks developed, like take your Oxycontin. There were all sorts of things. Again, a different presentation for a different time. But I think about the shortcomings of our systems that have limited access to things like mental health services, access to treatment in a timely and efficient way. And exploring some of those historical elements provides context and suggestions for our path forward. So I love this quote by Albert Einstein that's paraphrased, but that reminds us that when something's born from chaos or poor planning, like, let's just give everyone Oxycontin. We are benefited to look differently at how we approach the solution to these existing problems. Okay. In public health, we use this analogy a lot, and perhaps you've heard this several times, but we use this stream to illustrate these prevention efforts and what we're focusing on. And there's this fable that explains that you are standing on the edge of a river, and you start to see that people are falling down this river. And you're downstream and you're like, oh my gosh, there's like all these people, and you pull someone out, and then here comes another person, and you're pulling them out as fast as you can. But we use this stream analogy to really guide us and to say that if we're not looking upstream at why these people are kind of falling down and we're just reacting to pulling them out, then we're not looking at the whole big picture here. So upstream prevention, you may have, be really familiar with that. The nature of that framework, we also see sometimes illustrated in a pyramid, a diagram with the idea that your primary prevention is the base and foundation of your structure. So that it kind of is likened to your upstream prevention. And it's important to spend time thinking about how they're all interplaying here. Not one is more important than the other, but in our primary prevention, this could be things like focusing on youth education for opioids, running campaign strategies that talk to community members to educate them on the impact of using prescription drugs or locking prescription drugs up if you have them in your home. So kind of giving more ideas on resources. At the secondary level, this could be things like screening programs. So when you go into your doctor, like maybe having a screening questionnaire to check in. How are you doing? How's your mental health today? What kind of things could we help you with? This could be things like rapid rehousing programs for individuals that are actively using and maybe aren't ready to stop. This could be things like reducing stigma or just fast track treatment program for people that when they're ready for it, having that, not a million flaming hoops to jump through. At the tertiary level, we think about things like naloxone. So there's the existence of the problem and that we need to get life-saving medications out there so that we can reverse opioids and get them the help so that they can access treatment when they're ready. I borrowed this from NAMI, but this also relates to a lot of what we're talking about. And when we're thinking about the big picture of opioids and how the heck do we get there? We know that mental health really plays into this. In Alaska, these are really hard statistics. And for me in public health, we sit here and we look at this and we think, what can we do to make access to treatment easier, to get more behavioral health resources out there? How can we help with all of these things that relate to our social determinants of health? How can we help with reentry efforts? So it's both overwhelming and inspiring. Again, just recognizing, and this is part of this complex picture that we're talking about today with opioids, and it all kind of weaves together with knowing that COVID has had a really big negative impact on mental health, and that relates to kind of support systems and community structures and mental health. So it kind of all relates there. Where we might be striving to ensure that all Alaskans have healthcare access, we're also called on to creatively address ideas that support equity. And this is like a really big word that we're hearing a lot in public health: equity, equity, equity. But what does it really mean? So, of course, we can want all Alaskans to have, insurance and easy access to healthcare. But if we're not addressing like where they're at, what the needs are, if I have I'll use the community of Pelican as an example, I can say, great, we'll give everyone here health insurance and anyone that wants access to treatment can get that. But if we're not acknowledging that you live in Pelican, that you have specific needs based on where you live, then we're not addressing the equity of it. So in this diagram, equality is saying we can give everyone a bicycle, but we're maybe not setting them up for the most successful ride. And then with equity, we're giving folks what they need, but we're tailoring it to what their needs are and we're meeting them where they're at. Oh, it's 2024. So I am all about healthy optimism, and the glass is trying to fill the glass up. So looking back on 2023 and the evolution of our cause and relating to kind of those self-care practices, or kind of that expression like filling your cup, which could be like interpreting like we need some optimism in this field. This is hard work when we're looking at how do we address these complex issues of substance use and misuse and those dynamics with that. So if we're looking at some historical perspectives, like what's gone really well in public health, but also has taken quite a while. Let's look at tobacco. So on this graph is on the left-hand side, we're looking at 1900 all the way to 2020. Long time, long game here. But this is kind of, well, we never wanted the graph to go up in the first place, but it's an example of how our graph is now going down here. And I will also say that vaping has posed some interesting, it's posed another challenge. It's posed another spike in our tobacco cessation. But this to me really illustrates that things can take some time here. This is a long game, and that we all need to kind of hold each other up and work together as a community. We can't fix all of this in, 1 week or 1 month, and that this is a long game. Also, puffins are really cool. And I think it's kind of funny that we used this campaign for a long time in Alaska, that no puffin, but again, just to resonate that in tobacco cessation, in the annual consumption of adults, this was a lot of work that everyone did to kind of get these numbers to drop. And now we're faced with vaping, and we've got to kind of continue that effort in a sustained way. So we're talking also about harm reduction, and I've kind of woven that in with a couple of the things that we're mentioning here. And the principles of harm reduction, again, harm reduction could be a whole presentation on its own, but these tag words, or these taglines, are really the essence of it. Meeting people where they're at, and that most importantly, that we're acknowledging not everyone's ready to stop using drugs. And I think that that's really important to remember and hold, that we might have folks that being around drug addiction or having loved ones can be tremendously challenging. And it might be our internal wish that they just stop using, that they are successful. We can see the chaos, we can see the challenges, we can see the unhealthiness that it can create. But at the principles of harm reduction, that's really working with people where they're at, and mindfulness about how to make things safer. On this call is Joffrey Alter, and in this slide is Katie Jacobs. I'm not sure if Katie could join us today, but these are our local harm reduction extraordinaires. These are our Juneau champions. So yes, round of applause. These two work with the Alaskan AIDS Assistance Association to provide direct outreach services and support. I edited them into this slide. They work in a beautiful space in downtown Juneau. And if you're not familiar with that building or that space, you can look up the 4A's office, the Alaskan AIDS Assistance Association. We are a statewide organization that has an office in Juneau. We have a mobile syringe exchange unit. We just set up an office in Matsu, and we are out to help the world. 4A's was established in 1985, which is 39 years ago. I've been thinking about how we could celebrate our 40th party next year. But it was really set up as a support organization for people living with HIV/AIDS. And then over the years, 4A's has grown into the state's leading HIV/AIDS focused agency. And we support services for individuals, for people living with HIV/AIDS and families. But it's also a huge branch of what Katie and Joffrey do, is prevention and education. And so today, Monday through Friday, they run the syringe access program that provides safe disposal of used syringes. Last year, I think as an organization, it was like just shy of 1 million syringes. I have to ask Venus those numbers, but we are taking in folks that are actively using injection. And then more recently, like pivoting and turning to address the needs, we're seeing a decline in IV drug use and an increase in people that are smoking. That's a harm reduction strategy. Fentanyl, when people are actively using, are recognizing that it's a lot more unsafe to inject fentanyl, so they're smoking instead. And in response to that, Joffrey and Katie advocated, created, built, and got safe smoking kits so that people have the tools that they need to be safe. And we know that when people are using program services like what they do, they're 5 times more likely to enter treatment programs. So yes, thank you so much, Joffrey and Katie and the whole team at 4A's. If we look now and then, so looking at our past efforts and how these have evolved to keep up with the changes and requests from the communities, On the left, this was 9 years ago when we were first getting naloxone out. It was an IM draw-up kit. You can imagine that was wildly popular. No, people were terrified. It was like, here, we've got naloxone for you. This is before we had nasal spray. And this was with NCAD downtown. This on the right, you're looking at a photo. This is Project Gabe. And this is a new evolution of naloxone in distribution. So we've kind of built innovative and creative solutions that are meeting people where that they are at. We have these naloxone wall-mounted kits, and we have Cloxado now, which is a little bit different than Narcan. Narcan is a 4 milligram version. Naloxone is an 8 milligram version. And we're using that because we are struggling with fentanyl, and we know that people often need just a little bit more to come back. In 2022, we distributed 859 of these boxes across industries. We put them up in canneries and processing plants. We got them out on tenders. We put them in mines. So we're really working to kind of get naloxone out there, because we know that when people don't have access to naloxone, that their likelihood of dying from a fatal overdose goes up. And if folks aren't around, they can't make it to recovery. So when we're thinking about these needs and areas of focus, there's a framework that I hold close to my heart to keep me focused and centered. And every day I feel myself referencing this graphic and working to kind of break up patterns and habits that are embedded from nursing school and a lot of like the nursing system that I kind of came up in. And that was to kind of do things to and for people. I'm going to help you do things to get out of here. I'm going to do, I'm going to get you meds for this, and really trying to dismantle that, and steadily feeling that when I do things with individuals and communities, I'm such a better nurse. So this access is borrowed from Hattush Latish, our local coalition. And that, this access of support and control, and that ideally we're doing things with people. This also, Mary Perzak shared this at our Hattush Latish Coalition. Just really interesting to kind of think about this too in a reference to framework. And I examine this closely as it relates to a lot of branches of medicine, and where things are kind of coming from this colonialism, white supremacy culture of perfectionism, quantity of quality, like either or thinking, this individualism, progress is bigger and more, that we're really like shifting. And we're another way to think of that might be a lot healthier and productive is with this equitable culture of appreciation, power sharing, collaboration, 7-generation thinking. So we're thinking about what our efforts do today that might help us 7 generations ahead. I think of Christina Love and her just amazing optimism that recovery is always, always possible. And no matter what, if you don't believe someone's capable of recovery, Christina will tell you that's your work to do. So again, we'll dive in our last 15 minutes. What are some good things that have happened that have helped advance recovery efforts? Okay, the year in review. In January 12th of 2023, the Substance Abuse and Mental Health Services Administration, or SAMHSA, and the Drug Enforcement Administration, DEA, they issued guidance on the removal of the X waiver. So the X waiver was this horrible, nasty thing where it said, if you're a provider, we have to run you through a couple different courses in order for you to be prescribing medication-assisted treatment for addicted individuals that need that support, that need that lifeline. Dr. Grupa is the director of White House Office and National Drug Control Policy, and he said, if it remains easier for people to get illicit drugs than to get treatment, we're not going to be able to bend this curve. So we got rid of this waiver, and there's still a lot of work to do, but essentially we're trying to integrate. So if you see your primary care provider and you say, I am struggling with addiction and I would like to learn more about medication-assisted treatment options, my provider does not have to go through a million flaming hoops to provide that service. It's just like getting antibiotics if I had a nasty infection, just making that built into primary care, and we love that. More than $50 billion in settlement funds is being delivered to thousands of state, tribal, local governments from companies that have been accused of flooding communities with opioid painkillers and that have left millions of folks dead. So these are part of the opioid settlement funds. You maybe have seen some of this in local news, statewide news, or even federal news. It's a huge amount of money. It's double NASA's budget and 5 times the revenue of the NBA season. So we've got a lot of money that's kind of trickling out as a result of these huge lawsuits. With that, the total amount of settlement money coming to state and local governments can be a moving target. Most states still are having issues with transparency of how to spend that money and how it's being used. Money is being spent on treatment, overdose prevention, and controversially on some law enforcement efforts. So there's a lot to think about here. The settlements also require companies to change problematic business practices, and that sometimes can have unintended consequences. And many places still haven't decided what to do with that money yet. Mike Moore was the former Mississippi Attorney General, and he sued Big Tobacco in the South. And he has some interesting wisdom about settlement funds and how those could maybe be spent. I will, at the end of this, I'll drop into the chat. He wrote an interesting article with like, I sued Big Tobacco, and it kind of turned into a hot mess. Here are some ideas of what you could do. I just want to back up and say here in Juneau, we have some opioid settlement funds. And if you are interested in joining the Juneau Opioid Work Group Coalition or the Juneau/Southeast Opioid Coalition, this has been part of our ongoing conversations, is how can we help give some guidance on what our community would like those funds spent on and how they would like to see those interpreted. Another thing I just wanted to highlight here is the University of Alaska Anchorage has a Project Echo series. And so if you're not familiar with the model of an echo, this is a monthly reoccurring series, just like how NAMI does Inside Passages. But UAA will pick lots of different topics. So there's everything from elder and aging care to prescribing practices for opioids. There's family echoes, mental health and developmental disability echoes, co-occurring behavioral health echoes. So it's a monthly standing meeting. You can sign up for them, and you can look on UAA's website. These are really interesting, where participants come together, they learn, we do case reviews, and they're also pre-recorded. So if you're occupied and you can't attend on a topic that you'd like to see, you can get the recording back to you. But we have a lot of these echoes also kind of bridge together ideas and examples and help break down some of these really complex topics. Whoa. Did I skip a slide? Okay. We've talked a little bit about this, but trauma-informed care models have been a big movement for the past few years. I think specifically the last 10 years, we've seen a lot more focus and initiative on what does trauma-informed mean and using that lens. And we have more tools and techniques to address and recognize trauma that maybe lives in individuals, communities, and families. I was talking with a dear friend of mine, Natasha Jackson, and we were also talking about what's the future of this look like too. And we were talking about healing informed. And I loved that thought. I'm not entirely sure like what the future of this looks like, but trauma informed has been a really big push. And now, how can we use healing informed care models? Healing informed care is based on Indigenous wisdom about wellness and what's necessary to heal. And I love that kind of inclusion of thinking about ways that we're using trauma informed, but also how do we help ourselves heal and be better. Culture has been shown as a protective factor since forever. So I'm really interested in kind of the future of this and the expanse of that knowledge as a protective factor. Okay, I wanted to put my email down, and I will also put this in the chat. And then my last slide here. This was hanging on a friend's refrigerator, and it was an award that their artist friend had made, but it's an award for signaling the refusal of mastery and an instance on processing and becoming. And I loved this because I don't think that we could ever aim or hope to be experts or masters in any of this field, and that it's a fluid passage that we're continuously learning. And that I think we do that best when we're taking really good care of ourselves, and then when we're also taking care by talking and connecting with each other in our communities. So with that, I will stop sharing, and we have a little bit of time. Meryl, I did it. I didn't think we were gonna have time at the end.
You did so good. Oh my gosh, you shared so much with us, Claire. Thank you. Really quick before we open it up to questions, Claire, if people want to join the opioid task force, what do they do? How do they do that?
Yeah, I will put my email in the chat, and if you would like to be added to our listserv, I can add you in on there. We meet on the third Tuesday of every month from 9 to 10 a.m. And looking at this year, there's been a lot of interest in how can we develop more youth education and prevention strategies. It's a cohort of a lot of folks that come from a lot of different backgrounds and disciplines. So I will put that in the chat. If you'd like to join, I'll add you to the listserv.
Awesome. Does anyone have any questions for Claire? We're blessed with 10 minutes, 10 more minutes with Claire. If anyone has questions or other things they were hoping to chat about today.
And if you're anything like me, you'll be on a walk later and something will come to mind. So you're welcome to reach out. I would like to, there's some interesting articles. Thank you, Charity. I hope you and your baby are doing really well. I will drop, there's some interesting articles that have come out. So I'll post the links to those in the chat.
That would be great. And maybe you see Aaron's question there as well.
Aaron Surma, the tallest hockey player on earth, asked how do I stay informed, or what webinars or newsletters do I find helpful? That's an interesting question. I think yeah, I am a student myself, studying with the University of Colorado. So I have that amazing opportunity to be in a learning cohort. And I think what that is teaching me, that I hope to maintain through all of my life, is just to read and read often and look at lots of different information. But also to be careful with what information you're reading, and to kind of discern, like, is this accurate? Is it true? Is it helpful? And then having folks like our community here on this call to process. I was telling Meryl that creating this presentation is is in itself a really neat reflective practice, to kind of look back on the past year. And I hope that it was interesting and helpful to kind of do that year in review, and not just because we're in the beginning of January, but I think what I'm trying to say is that this work is hard, and it's quite complex and can be very messy and emotional. I have lost many of my peers from my graduating class here in Juneau to struggles with addiction and suicide. And so I think giving that moment of pause and reflection, engaging in those self-care practices, can help me gather more information thoughtfully so it's less overwhelming. Yeah.
Wonderful. Any other last minute questions for Claire? And thank you, Claire, for sharing these links in the chat.
Hi, I wanted to make a comment. Thank you so much, Claire. I loved your presentation. So beautiful. I also want to put in a little like a thing in for Al-Anon for support for people that are family members of addicts or alcoholics, and it's a beautiful place to be, to come to talk and to get support, and those are community-led meetings. One's on Tuesday at noon at the Northern Lights Church, excuse me, and the other one is at 10:30 a.m. on Saturdays at Northern Lights Church. So that's the only thing I wanted to add. You did such a wonderful job. Thank you so much.
Thank you, Noreen. Can't wait to see you in person.
Awesome. Thank you so much for adding that, Noreen. Thank you, Claire. We'll keep it open for a couple more minutes so people can make sure they download all those links. And I wanted to say our next Inside Passages, so Thursday, February 1st at noon, is going to be supporting neurodivergence in a neurotypical world, where colonialism and ableism affect modalities of care, with Madison Truitt from the Tlingit and Haida CBS Healing Center. And I think it's going to be just as awesome as this one. So we hope to see you next month. And yeah, we'll give everyone a minute to make sure they get those links. Claire, thank you so much for being here. We're so grateful for your wisdom.